Coming up next on WVOX, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Good morning, good afternoon, hello, Monday. It is Mark Brownstein here with Emerald Medicare with a very special guest here, Jim Sullivan. I am somewhat new to WVOX and really honored and proud to be a part of this radio station. I bring on guests who really are involved in supporting seniors in various capacities. The work that we do as a company is really helping people understand and navigate Medicare from Part A to Part B to the supplement. It's what we do. It's what we love to do. It's what we do all year long. But today isn't about me. Though I'll sort of just remind you that our phone number for any support is 845-358-1220. I'm here with Jim Sullivan from iCore. Welcome, Jim.
Hey, Mark. Thank you very much for having me on, and I'm very excited to be on the air with you.
Well, I know that you've been on the air here at WVOX before, so it's nice to have you back. And I know you know some of the folks here that have been around for a while. So you are born and raised of some sort, raised your family here in Westchester?
That is correct. I was actually born in Yonkers, and my father was a councilman there, and so deep roots to Westchester County. When I was fairly young, we moved up to the Bedford area from Yonkers, and I spent and raised, after college, raised my kids for 20 years in Rye, by and large. So there you are.
So, Westchester raised the children, and you have 3 kids, right? 2 boys and a girl.
I have 2 boys and a girl, yes, a 26, 24, and 21-year-old.
Any of them living at home?
The 26 has been for a couple months now. Okay. He gave up his apartment in New York City, moved back, but is now looking to move back into the city. 2 years of COVID paying for rent, and just needed to a little change of space.
Well, so we all have a very interesting background to get to the point where we are. But, iCore is a business that you have built. It is a business that's really services regionally. But for people listening on the air, what would you say is an overview of what iCore does for the seniors and their families in this community?
Thank you. Yes, iCore provides really individualized life care management services to seniors and to a certain extent individuals with disabilities as well. Those services are comprehensive, that run from medical, their medical needs, environmental, where they live, how they live, psychosocial, how to get the best quality of life, and financial and legal. So we really sit at the crossroads of all aspects of their care and really work with families and individuals, of course, on how best to take care of their care needs.
So it sounds like more of a quarterback in many levels to help someone's care where they may not be able to navigate, understand the resources, understand the options that they have as someone becomes more vulnerable and maybe frail.
That's exactly right. And many, if not most of our clients, whether we're called by the individual themselves or their family members, really reach out to us initially to find out, where do I start in this process? What are the needs? How do I navigate the system? It is a very complex clinical and medical environment in which you know all too well, given what you do. And we are really there to become a partner of the family. We really become that adopted son or daughter within the family on helping the senior live the best life that they can, whether that be living independently in their home, or wanting to move into an assisted living, or those with greater needs that need to go into a skilled nursing facility. We really work with all of them.
So I have, as you know, I was involved in elder advocacy prior to my work in Medicare. So we got to know each other while I was in that transition, making a decision on whether to stay in elder advocacy. But what I know about this with passion is that the dynamics of the family is some of the biggest challenges, right? Whether you're talking about the adult children or the person wanting to make the phone call on their own, wanting to be independent and find their own help without involving the children. How do you see that dynamics playing out, and how much time do you spend in that kind of a role?
You hit the nail on the head. That is a key component. We want to let family members be family members and act like family, not be the caregiver, not necessarily, want to have them involved in as much as they can and want to be. And the senior, they want to be as independent as they can. They've spent, 70, 80 years being fully independent, and now they need help and they feel vulnerable. But, it's nice to have an independent third party to help that out, rather than some of the family dynamics that just play into that come into play with regularity, and really allowing that family member to step back and breathe. That's a big thing. And we have clients starting with us every day that is a key point. They say, I don't want to be in this role. I'm the bad guy. Please take me out of, and not that what we do creates a confrontational relationship, but when you have family dynamics coming into play, it just makes it more difficult for the individuals.
Well, it's complicated, and in some cases, family members are local, and some of them are long-distance caregiving. And so people don't stay as close to home as they used to. So how much of it would you say is long-distance caregiving? Are you working with family members that are
in California? Local? Yeah, we have family members who are in California, in Florida, in the Carolinas, in the Midwest. Really, I would say that probably equates to 25% of our client base are those who are not local. And that really is key. But it's the sandwich generation too. You have families who may be local, but are raising their own kids, right, you have dual working parents. So being able to have somebody to pick up the ball and run with the complexities of navigating today's healthcare environment, and putting the services in place that that their loved ones need, and that's what we do.
So communication is also key, Jim. And being able to communicate to the various constituents, I would guess call them, or family members, has got to be an important part of your ongoing connection to them. How do you sort of communicate all of the things, all of the aspects of care that are needed and needing to be understood by a family?
Right. And so when we get started, I'll answer that in two parts. It really depends upon what the family would like to, the construct of how they would like to be communicated to. Mm-hmm. So in certain instances, you might have one point of contact with the family, but multiple siblings who want to ask questions. So we will schedule, whether it's regular calls, weekly calls, biweekly calls, whatever they want, so all can be updated. But really, it comes down to initially, when we go into any situation, is developing a care plan from the outset. What are the goals and objectives of the individual? What are the goals and objectives of the family? What are the key components that need to be put in place? And being able to set those milestones and report on them to the family members is exactly what they want to know what we're doing. And we have, sometimes with certain family members, it might be speaking to the family members multiple times a week. Sometimes it may be a couple times a month. It really just depends.
So there are a number of professionals within the context of the services that you provide that
right.
are involved in this family model of care.
Yes.
Can you explain some of the professionals that you hire, maybe even the skill set that they have?
Yeah. So again, that comes down to that initial care plan that we establish and identifying what the needs are based, not just on the goals and objectives, but what are the specific needs? Is the senior a fall risk now? Do they need in-home care? We will go and work with many of the home care agencies that may be in and around Westchester. We know who they all are. We know the ones that really we're not doing Google searches for these providers. We know them well. We know how they operate. We know what they need, and they know what we expect. So whether it's a home care agency to providing the care, a caregiver, whether there's a private caregiver, some families don't want to go through an agency, just want to have somebody who is in there, whether it's live-in or shift work that's happening. Sometimes, very often, there are. And by the way, we may be accompanying those seniors to physicians' offices to their periodic appointments. If some memory issues are in place, very often the family member wants to hear what the doctor says and don't always feel that they get the straight answer from their loved ones. So we're there to be the advocate to the doctor, and that's one of our registered nurse advocates, which is one of our key team members. But getting back to your point of who else is in there, whether there is, social programs that we need to enlist, whether there are, services that need to be brought into the home, meals, whatever, anything that's required, we can make that happen.
So the nurse advocates and other professionals during this COVID world that we've lived through, yes, and hopefully we're on the other end of, but it's hard to say. How has that been, and how has the protocol, and what have you sort of learned from it as you've put resources out in the field?
Well, it's interesting. The COVID created an interesting dynamic for us. You can't just put someone's care on hold. So really, we needed, it was, and the CDC had their guidelines, but we had to exceed what those were. So our registered nurse advocates, and again, that's what we call our care managers, registered nurse advocates. They all are RNs by training.
I like that title.
Yeah, and so they have a clinical first approach in that, and our team is basically broken down between their registered nurse advocates, and they are paired with our client care specialists. So think of the registered nurse advocate as all things medical, and the client care specialist thing is all things non-clinical. And that might be ordering durable medical equipment. It may be just arranging for the transportation, but they work as an interdisciplinary, holistic, coordinated team. And so there's no duplication there. But in any event, during COVID, the registered nurse advocate, again, we had rigorous training protocols that we would follow. All caregivers needed to be tested regularly who were going into the home there, and our clients were regularly tested. So we had to make sure that that was all safe. And really, we were inundated with new clients during COVID because the family members did not know how to respond, what to do, worried about bringing COVID into their own homes at the time. So our phones were ringing off the hook at the time on engaging with new clients at that point in time.
So the experience from what you've told me of these nurse advocates are fairly significant. And again, hiring in general has and retention in this in COVID model has been challenging, I'm sure. But they have minimum 10 years.
Yes.
Is that what you've told me?
Minimum of 10 years.
Right.
Yeah. So we're looking for new registered nurse advocates right now. A minimum of 10 years is a baseline stipulation as far as their background, but more often than not, they've got more than 20 years. We have a fantastic managing registered nurse advocate who has got a master's. She's been in the field for 30 years, and she is really a special individual, and the other team members are as well. So again, being able to bring that, and by the way, they not only have the tenure, but their experience, we do require a minimum of that somebody has ICU or critical care experience, emergency room, able to discern what some of the critical issues may be very quickly and develop a plan of attack on that. We don't provide hands-on care, as you know, but we are that bringing all the disciplines under one umbrella to make sure that it's being taken care of.
What a valuable resource, Jim. Again, Mark Brownstein, Emerald Medicare, him with Jim Sullivan, the president and managing director of iCoreCare.com. That's the website. What's your phone number? How do they get a hold of you folks?
Okay, again, and by the way, for the listeners, iCoreCare is IKORE, MorkCare.com. Our phone number is 888-669-3227. That's 888-669-3227. We have offices in New York and in Connecticut, and we service the entire New York State region, the New York City metro region.
An incredible, valuable resource. Westchester has a tremendous number of resources, a tremendous number of home care agencies, a tremendous amount of nursing homes and assisted living. And I want to come back to what you said earlier is, you know who the good ones are.
Right.
And so the people that are listeners who have tried to navigate this on their own, maybe they Googled, maybe they asked a friend, maybe they asked their attorney or their accountant or their financial planner. So you work with planners, you work with other trusted professionals, but knowing the resources, I think, is incredibly valuable for a company where the number of resources that are available are enormous.
Yes, and that's key, because it's not just one. It's not one size that fits all. But B, you've got multiple disciplines that you're having to bring under for one individual. So it's not just the home care, or and perhaps there might be some other issues that you're dealing with that go beyond just the clinical aspects of their life, depression and things like that. And mental health is so key. So we bring any and all those under one umbrella to help shepherd those and coordinate those individuals. We have many clients who might have 8 different medical providers. Mm-hmm. Some are in the same network, some aren't. Some are prescribing medication, but they don't know what the rest of it is, what maybe the other physicians have prescribed. So we're ensuring that there is that everything is coordinated, that there are no conflicts there, and that and everything is as it needs to be.
So some of the non-clinical, which of course I understand on my end, is right. Billing, medical services that are being mailed to them, understanding their insurance plans. So that's part of the non-clinical work that you folks can do for clients?
Absolutely. Working with professionals like yourself, with your, what Medicare plan should they be on, as time goes on. I've got this bill. Why is this not being covered? Well, we very often the coding may be wrong, but being able to pick up the phone and navigate that with the physician's office, get that resubmitted to the insurance company, that's a key component. As I say, we sort of sit between their attorney, their financial advisor, and even some of the the other professionals who support them on the clinical side, and really help just be the traffic cop to make sure that everybody's talking to each other. So on the medication side, we talked about this earlier. People sometimes are taking many medications. Some of them, nobody's really looking at them separately to see if any of them have a negative impact. And so is that... Yes, we work with a service, and we ensure that all the medications are that there are going to be no adverse reaction from the others. So that is a key thing that we do. We ensure that there are med pours set up if somebody needs to come in and do from multiple providers to make sure that those are being administered properly. We can set that all up. Working with very often consolidating pharmacies. They might be going to 2 or 3 different pharmacies, depending upon where the doctors are, but ensuring that all these things are put in place to that there are no, because medication problems, as you know, are a leading cause of issues for seniors.
And hospitalization.
Yeah,
absolutely.
Exactly. And even from the hospitals themselves, we have to ensure that
well, that's an interesting statement. Hospitalization prevention is really what every insurance company is looking to do.
That's right.
And so if you and in the work that everyone does in healthcare, physician specialists is trying to prevent hospitalization.
That's right.
That's what's saving or maybe keeping our premiums at a somewhat reasonable level.
Exactly.
Or else it would go quite a bit higher. So you work with other professionals who refer business to you. Talk a little bit about that, because there's all kinds of people who listen to this show, and
sure.
They might need your services as well.
Yeah. So we work, whether it be your trust and estates attorney, we get a lot of referrals from trust and estate attorneys, elder law attorneys, financial advisors, bankers. It really runs the gamut of other professionals and doctors' offices. So somebody may very often will walk into a doctor's office and they're like, I had no idea that your service existed out there, because they want to know that their directives that they're giving their patients are being followed after they walk out of the office, and they might not see them for another 6 months. So having somebody who is advocating and working with the individual and the families to ensure that the best care is being provided, that's key. And so it runs the entire spectrum of professionals out there.
So I know in my line of work, financial planners, CPAs, doctors' offices also refer business because they need someone who can sort of guide the client, educate them, and make sure they're on the right path.
Yeah, everybody should be enlisting your services, especially. I mean, there's no downside to ensuring that their Medicare is where it needs to be.
There is no downside, mostly because my services are free.
Exactly.
You have a model where you do take long-term care insurance, but also private pay.
Yeah, we are private pay, and we do work with long-term care policies to the extent they allow care management to be utilized underneath them. Some do, some don't. But we are a private pay model. And again, I spoke to it earlier. Our pricing is built upon, depending upon which service you need, whether it's the registered nurse advocate or the client care specialist. There's the clinical side is a little bit more expensive than the client care specialist, but they average out. So it is. We are very cost effective for the individuals when managing their care.
So, when we prepared for this, we talked about great stories to tell, to sort of share with the audience. You shared a couple. If you can just share a story or two of great success that you've seen and the joy of the family and or the
sure. One that comes to mind is we were brought into a situation. An elderly couple had moved into an assisted living community. Unfortunately, one of the couples had one of the individuals had passed away, and the surviving couple had not wanted to stay in the assisted living, but wanted to go live independently. So we were able to, in fact, recreate all the support that he was getting in an assisted living, in an independent living scenario, and gave him years of ability to kind of live the way he wanted to independently. Then again, we are often brought into situations. There's one that comes to mind of a family who was living in California. Their mother had come into town for Thanksgiving and had realized that mom needed a lot of extra help and did not know where to start, and they were remote, and how could they do it? And their mother was open to living in an assisted living environment, but really wanted to stick it out as long as she could in the home environment. And we were able to go in there, assess what the needs were, look at the environmental needs, make some minor modifications to the home environment to make it more safe for her, and then really put all systems in place and the care and check in. So we would physically check in on her a couple times a week, and she was able to live the way she wanted to, and then ultimately, very happily, transitioned into assisted living community several years down the road. So I could go on and on with many different stories, but it's It's
a really important area that people don't know the services exist. They often say that about my services. They can call an insurance company and be guided towards one company, or they can call an independent person who's really going to make sure that they understand, move forward, and are there on an ongoing basis. And that's certainly what you are. You're there on an ongoing basis. You have the team in place to be able to support so many clients at one time. So what gives you the most joy in the work that you do, and or the staff that is involved in the work that they do?
Well, first and foremost, I have a tremendous team behind me that I'm working with them day in and day out, and making a difference in an individual's life is incredibly rewarding, and So that is first and foremost, is making a difference in the life that they in their lives, and letting them live the life that they want and the best quality of life that they want. Is first and foremost, and we are just rewarded every day by our clients and knowing that we are able to provide that, and being able to work with a group of professionals like I've been fortunate enough to bring on board. So
again, company and phone number.
Okay.
Website.
iCore Life Care Management Solutions, but the website is www.icorecare.com. That's IKORCARE.com. The phone number is 888-669-3227. And happy to have a discussion with anybody who calls in and see how we can be helpful.
Jim, we've known each other for a while. It's nice to have you on the show. I'm Mark Brownstein. I do Medicare. I support really almost 1,000 people a year in educating them on Medicare. Between webinars, seminars, phone calls, we are a busy office. Our core is New York, New Jersey, Connecticut, but we quite honestly cover 17 states around the country. It is so important to have partners like you, Jim, to be able to refer business to when the needs of Medicare go beyond Medicare and get into the chronic needs that are important for maintaining life. So I want to thank you again for being a part of my show.
Well, I thank you, and I thank you for the work you do and the camaraderie of working with you day in and day out.
Thank you, Jim.